Hi guys, Dr. Shaun here. Hope everyone's doing okay today. Today I'm going to be talking about root canals versus extraction. Okay, so we got to decide whether we want to save the tooth by doing a root canal or just letting the tooth go by extracting it and placing another type of restoration. When a tooth is decayed or damaged extensively, we have a couple options to choose from. The first option is root canal. When we do a root canal, we're ultimately trying to save the tooth. If the pulp of the tooth is irreversibly damaged, then the only way to actually save the tooth is to do a root canal. And the process is we numb the patient up, we use special files to clean out the pulp space, we place like a gutta percha filling material into that canal space, then our restoration is fabricated. With root canal procedures, there's little discomfort after the root canal procedures. Some discomfort, but usually the endodontist will give you some sort of pain meds if you need them. A lot of patients don't, but just in case. The other option, if we don't want to save the tooth, or if we can't, is to let the tooth go by extracting the tooth. A lot of times people choose this due to financial reasons, or maybe the tooth is just not salvable. Okay? When you're extracting a tooth and placing an implant or placing a bridge, we're talking about a lot more finances. So sometimes it's just less expensive to go the route of just trying to save it to do a root canal. The process of the extraction is pretty simple. We just numb the patient up, we loosen the tooth with special instruments, then we just pull the tooth out. Now with extractions, sometimes you'll hear sounds, if you're awake, of the bone or whatnot, or just ligaments or things kind of breaking here and there. But again, there's not really much pain. There can be some pain and soreness after the procedure, probably a little bit more than a root canal. But again, the oral surgeon will give you pain meds and anything to kind of make sure you're comfortable. Now, once that tooth is out and everything's healed, then you can place an implant, you can do a bridge restoration, or even a partial denture. So there's a couple of options after you do the extraction. But in my professional opinion, when it comes to either saving the tooth by doing a root canal or getting rid of the tooth by extracting it, I always aim for trying to save the tooth first and foremost. There's nothing like your own natural tooth. Also, when you do an extraction, it's a lot more expensive and a lot more time consuming by doing the extraction, letting it heal, maybe placing a bone graft before you place an implant or a bridge. So there's a lot more, and there's a little bit more discomfort after extraction than there is after a root canal. But I definitely always aim to try to save teeth in my office here, no matter what, first and foremost. It doesn't matter, I always do. If for some reason it's not salvageable, then we can talk about other avenues. So just discuss both options with your dentist so you can be properly educated before you make the decision, okay? Well, thank you guys for listening today. If you have any questions at all, please don't hesitate to ask. I love answering your questions. Have a great day.